Good evening, everybody. Thank you for joining one more time. We're going to be in a different location tonight, and I want to kind of do a revamp of what we have gone over in regard to risk factors. The whole idea of looking at all of the risk factors for maternal death and pregnancy is so that you can begin to look at your family history, your own medical history, the history of the baby's father, dad, your past pregnancy history, if you've been pregnant before, looking at your menstrual cycle, that history, any sexual history, all of that. We have, over the last few days, gone through different risk factors for the causes for maternal death. And what I want is, with all of this review, is for you to take a look at yourself and to see, where am I with all of these risks? So I'm going to run through things a little bit again tonight. And what I would like for you to do is to begin checking all of these things that apply to you. I will be developing a checklist that I will be sharing later with my audience. And this will help you to identify, where are you with these risk factors. And this will then help you to make decisions about what type of providers should be taking care of you during your pregnancy and birth. Where should you deliver? There are many options for where you have your baby. Not It doesn't have to always be in a hospital. It could be in a birth center, it could be at home, and all of these options are safe depending upon your risk factors. So what I'm going to do is just to kind of run through things again tonight. I'm going to throw up a few slides that we can review, and I want you to start taking some notes and mentally considering everything that we're reviewing. Tomorrow, we're going to move into the weight gain during pregnancy. Again, that is another large area that can cause many areas for women to kind of run off the tracks during pregnancy. But let's get going with looking at the risk factors one more time. And I want you to, again, to begin identifying for yourself. Sorry about that. I just kicked the slides out. Once again, these are the main reasons for why women are dying in the United States. Understanding that Black women are dying at more than twice the rate of white women. Women who are age 40 and over are dying at an exponentially higher rate. And when you look at where we are for industrialized countries, United States is off the charts. We are really, really not doing a good job. Mental health, this affects white and Hispanic populations. It is the largest cause for maternal deaths in the United States at 23%. Almost one-fourth of all women are either taking their lives or having some sort of overdose. This is up to the first year after they've had their baby. Excessive bleeding, what we also would call hemorrhage, 14% is affecting mainly Asian women. And this is where you're bleeding too much after you've had the baby. And this can occur, the amount that's too much is half a quart. That's, once it goes beyond half a quart, it's considered hemorrhage. Cardiac and coronary diseases, this affects the Black population the most. Blood clots, cardiomegaly, these are the other causes for maternal death. So now let's start scoring. I want you to start thinking of how this is affecting you, or what are the factors you might have, so that you can begin to monitor your health, take control, and be in charge of your health care. Race is important. We already have identified, if you're Black, you're more at risk for cardiovascular and coronary disease. If you're Asian, you're going to be more at risk for hemorrhage. If you are white and Hispanic, you're going to be more at risk for mental health problems. And Native American women are suffering from all of these things. So let's look at cardiac and coronary disease. Look at your family history. Start writing a note to yourself. Is there anyone in my family with cardiac history, particularly if they had cardiac history at a young age? I'll give you an example of that. My brother, at the age of 40, had open heart surgery. He had his first heart attack when he was about 32 years of age. That is considered young age. Your own medical history. What's your blood pressure like? Are you obese? Have you done the BMI calculation? Clearly, if you're Black, you are going to be more prone for this type of problem during pregnancy. Let's look at hemorrhage. Are you of Asian background? Then you need to tick yourself for that. In the past family history, was there any history of hemorrhage? It's where you need to go and ask your mom, what happened when any of us were born? Did you have any problems? Did they tell you that you bled too much? Your own past pregnancies, did you have problems with hemorrhage with the past pregnancies that you've had? What about the current pregnancy? Is your labor getting to be too long? If you have Pitocin to augment your labor, if you have a very fast labor, these things are going to set you up for postpartum hemorrhage. If you have twins, triplets, this will also set you up. If you have too much bag of waters called polyhydramnios, that will also set you up. If there was preeclampsia in this pregnancy, you are more prone to having hemorrhage once this baby is born. And if there's any infection of the bag of waters, you will be more prone to having hemorrhage. So start ticking all of these things. What about mental health? Mental health, once again, let's look at the race. This is something that's happening mainly for white and Hispanic women. So then we need to watch out for this more with these populations. Is there past history of depression or anxiety? Past history of any kind of postpartum depression? Are there problems with any previous pregnancies? Sometimes the pregnancy can be seen as a traumatic event for the mom. So were there problems with a previous pregnancy? Has there any history of sexual or physical abuse? If we were to look at what's going on with the current pregnancy now, are there problems with the relationship with the father? Or even within the extended family, these things will affect mom. Are there stressful life events that she's going through? What about her socioeconomic status? Is there enough money to cover the needs during pregnancy? Are there any problems or complications in this pregnancy? All of these things will make you at risk for mental health problems once this baby is born. So, why understand your risk factors? Because it's going to help you to determine, where am I as I begin this pregnancy? Who are the type of providers that I need? Is it going to be okay for me to be with a midwife? Or do I need to have a doctor or even a specialist known as a perinatologist, who is the specialist in high-risk pregnancies? What kind of facility should I be having my baby in? Should I look at the possibility of home birth? It's something that I might have desired. Am I going to be okay for that? What about having my baby in a birth center? And then, do I need to be in a hospital? All of this will help you to monitor your own health, to know where you're starting when this pregnancy is beginning, and preparing to have a really healthy pregnancy and the best possible outcomes for you and your baby. So thank you again for listening to this. This is going to wrap up the series related to risk factors during pregnancy. We're going to be again moving to preparing yourself for a healthy pregnancy, a couple of sessions on that. And this is where we're going to talk about weight gain a bit more. A lot of women may need to deal with their weight before they become pregnant. If you are overweight or underweight, it can affect your ability to become pregnant. And so when I say overweight, I'm talking obese. I'm talking about uh, not your thought, oh, okay, I'm overweight, I weigh this. With the BMI calculator, needing to understand where do you lie? Are you obese? And obesity has obesity 1, obesity 2, obesity 3. Today, weighing myself today, I'm falling into the obese range. I don't want to be there. If I lose 3 or 4 pounds, I'll be overweight as opposed to obese. So I need to work on my own self. I love chips, that sort of thing. But I need to work on my own diet. So thank you so much again. I hope you have liked the content that I have brought to you tonight. I ask that you will like, that you will subscribe, and that you will share this YouTube channel. We're going to continue to have great content helping you to be able to understand the health system, understand yourself more so that you can be greatly in participating in decision making. Thank you. Have a good evening. Bye bye.